Back pain is one of the most common causes why people visit any physical therapy clinic. So in this video, we will be talking about lahat ng klaseng back pains. Lahat yan pag-uusapan natin dito, preventive measurements, at saka anong mangyayari pag hindi mo binigyang pansin or inignore mo yung mga symptoms na nagkukos ng back pain. Spondylosis, or what is called as spinal osteoarthritis, is a condition when your disc starts to wear and tear. Basically, it's an age-related issue. So it can basically happen anywhere from your cervical spine, thoracic spine, or even also in your lumbar spine. When the disc inside of each of your spine starts to deteriorate or dehydrate, so it becomes susceptible to have irritation, inflammation, and therefore, over the course of time, if you keep ignoring this one, it will cause a back pain. Also, some other related condition that can occur together with the cervical spondylosis is like cervical radiculopathy or nerve impingement because of ignoring the symptoms or ignoring the spondylosis over the course of time. May mga ibang pasyente, nagtatanong sila sa akin, bakit meron akong ganito at an early age? Usually, if involved ito sa genetics or yung work natin is very strenuous that requires you to lift, will also create repetitive wear and tear if you're always bending forward. Ano naman, naka-desk work related yung yung job mo, then palaging pangit yung posture mo, naka-bend forward ka or nakayuko ka palagi, then over the course of time, you will also have a cervical spondylosis or wear and tear of your disc. Now, may ibang pasyente rin nagsasabi, Doc, anong gagawin ko pag meron akong spondylosis? Is there a cure? Actually, there is no cure. So what we can do is always avoid yung mga nakaka-trigger ng back pain natin. So, yun nga, tulad ng sinabi ko, avoid prolonged positioning. Also, if your work is always nandun tayo sa palaging nagbubuhat ng mga mabibigat, then please do proper positioning when you're doing your lifting techniques. So now, let's talk about any general low back pain that if nagpa-x-ray ka or nagpa-check up ka tapos wala ka naman nakitang spondylosis or nerve impingement. So if you have that kind of issue, it might involve from your work or simply sa mga ginagawa mo every single day. So, palagi kang yumuyuko. So, anong nangyari pag yuko ka ng yuko? Ang nangyari, meron tayong muscle spasm and pwedeng mawala yung flexibility ng lumbar spine natin. Instead na meron kang lumbar lordosis, magiging lumbar straightening to. Any person that is involved na prolonged positioning, na palaging upo tapos palaging naka-hunch or nakapangit yung posture, this is highly risk for you to have a lower back pain. So wag na kayong magtaka bakit na kayo nagkaka-lower back pain. So dito papasok yung mga tanong, Doc, anong gagawin ko para mawala yung lower back pain or maiwasan ko or ma-preventive measurement para maiwasan natin yung lower back pain? What I always do advise sa mga pasyente ko na may lower back pain is always avoid prolonged positioning. Now, no matter gaano ka-perfect ang posture nyo when you are sitting down or when you're standing up, pero kung ikaw ay nasa posisyon na yon, let's say for example, sitting down for too long, more than 2 hours, 3 hours, tapos tuloy-tuloy mo to ginagawa every single day, then wag ka na magtataka bakit may lower back pain. So the technique here, while you're having a good posture, is always change your position. So, kung nakaupo ka, every 30 minutes, tayo ka. If nakatayo ka, then every 15 to 20 minutes, upo ka. It's just like that. And also, aside from the work, please stay active. Try to stay active. Just a little bit of walking will do, or do some core strengthening, or any single thing na pwede nyong gawin just to help gain strength, lalo na sa legs natin. Because if you're just involving in sedentary lifestyle, tapos naka-work, nakaupo lang palagi, then even if meron kang physical therapy na ginagawa, this will not really masosolve yung issues. We will just provide us temporary relief, tapos after doing the bad habits, babalik na naman yung pain, tapos ganun lang yung cycle. What we want to do is break from that cycle, solve the pain, and also help us to solve the root cause, which is avoid prolonged positioning. So let's say for example, you watch this video and nagawa mo pa rin yung mga tips na sinabi ko. So what is next is that I want you to please come to our clinic and let's check that. Alamin natin talaga ano yung root cause, kung kailangan ng X-ray, MRI, para malaman natin kung ano talagang sanhi or anong klaseng uri na meron kayong back pain, whether if it's spondylosis, whether it is because of a symptoms of sciatica, or because of a slip disc na nagkukos ng sciatica. So madaming issue yan, madaming causes kung bakit kayo may back pain. So unang-una dito is alamin natin, assess natin yung condition and know what's the root cause of your problem, and then from there, create a treatment plan that is suitable for you. Because hindi naman lahat ng pasyente iisa ang treatment plan. So we tailor each treatment plan designed for your body. So like we always say, feel well at Fadisab.
Feel well at Fadisab.